I'm here today to get my under eyes fixed. I have really dark circles under my eyes. I'm here to get stem cells and fat transferred there so that the darkness goes away and they are more bright. I've done a ton of research. I'm a board certified endocrinologist and I'm a functional medicine doctor. I deal with a lot of people with autoimmune issues. I have some autoimmune issues. I see so many issues in people who have other procedures where they put something that is not theirs in their body and then they have terrible outcomes. Maybe it doesn't take, or whatever they put there migrates and moves, or they end up having areas where I think they call it tindling, where it like pools and it just doesn't look as natural. I wanted something that would fix this for a long time and I was not going to have a reaction to. I know that when you use your own stem cells and your own fat like Dr. Newman does, I'm not going to have a reaction. I'm not going to have all these terrible migration issues. This is the first time I've ever been here. I actually live in Oklahoma City. I met Dr. Newman at Mindshare, so a medical conference, and I met him through Nicole McPherson. I've looked at his stuff and I think that what he does is really amazing. His skincare line, all of it, I think is state of the art, the forefront of medical education.
Hello.
Hi.
How are you?
I'm good. How are you?
Good to see you.
Me too. I'm ready.
I'm ready. You're like the perfect candidate. You don't like this. Most of that is shadow effect. If I press, you see it doesn't really blanch. Not a lot of red cells. I think once we do it, it'll get a lot lighter. You see this? That's what the eyeball sits on. You've lost this volume here. Fill that out. You won't have this shadow in the valley of that. It goes away. That pocket of fat disappears. Better. Once I fill it, you'll look the same way when you're looking at it. You won't have that valley over there. And that'll make you look a lot younger. You have a little bit of redness here. You see that? Mm-hmm. Maybe the laser will help that, so you won't have this blood vessels.
I just want it to be a lot brighter.
Yeah.
You know, like how people's eyes are bright.
Yeah.
Mine are never bright.
Well, we're gonna
even when I'm well rested.
That's the thing. You're gonna look rested. I just want to make sure if I stretch it, you see that redness. You see the blood vessels are right there. So I'm gonna laser that for you. I'm gonna laser it. We're gonna do the stem cells, and then I'm gonna do a stem cell peel. Even brighten it a little bit more.
Love it.
Where do you have fat for me?
So I have some.
We talked about this.
Yeah, I have one here that's kind of messed
we're gonna
up.
Look at it. If I can fix this, that's just the bonus, and we'll do that.
Great.
You're gonna have two parts of this. One is the numbing and taking out the fat. So you're gonna be sore wherever I do that for a couple of weeks, like you had a muscle workout soreness kind of feeling. That goes away, and usually it's not a big deal. That will probably be more sore than the face, but the face you're gonna get swelling, probably 2 weeks. The bag that you had may be a little bit more noticeable because of the swelling, and then it'll go down. Putting in cannula there, so it makes it swollen. You're gonna get inflammation from all the stem cell stuff. Questions, concern, easy. Let's go do it.
Let's do it.
We're gonna make sure she's comfortable and resting before we
don't buy anything super expensive.
Big purchases that I've been waiting to do later today when she's in.
Oh, when she's on the pill, you have her sign whatever you want. She won't remember anything.
To wear your own underwear, you can. The risk is we use betadine to clean it, so you.
I'll wear your sexy underwear.
They're awful. Sorry.
That's fine.
You can also put them on and change your mind too. Gowns on with the ties in the back, and then you can put all of your belongings in any of the lockers. When you finish, turn the key and keep this around your.
What a cute idea.
Look at it.
See how it's like divoted?
Were to take a little bit from this inner thigh so that they don't touch, it will look better, but I would have to do both sides. They're not that asymmetrical. If I'm only to do this will look smaller, so I have to do both. If you want to do the inner thigh, I can do that, and then you won't have that divot looking there.
Whatever you want to do, but that bothers me.
That's what I want to fix. They went in like this, so that you have a divot right there as well. You can't see it as much, but you have the same. I can do that to fix this, or I can just leave the inner thigh so we don't touch where everything is looking good. I can fix the hole there by putting some cells in there. It just makes it smoother. I think maybe that will look better, yeah.
Whatever, I trust you.
Aesthetically, this will look better. If I do the banana folds, the bottom, you're going to be sore sitting down. 500 should be enough. This area, I'll take 20 cc's for this thing, and over here 20 cc's. Laser, stem cells, peel. How out do you want to be? If I give you 2 pills, you'll be sleeping.
Half a glass of wine.
Yeah, so maybe give her 1.
If anything is uncomfortable, he knows it.
Right.
The only thing you really feel is like just pressure.
It's not really painful.
I'm not a nervous person.
Yeah.
I have a very high pain tolerance. My husband likes to say I do all sorts of uncomfortable things to myself for beauty all the time.
The laser is very bright. Light is gonna in your eye. Even though it's not in your eye, it travels through the sinuses. It'll lighten up some of this. So I'm going after that redness there. You'll get lighter. So let's give it the pill and then we'll do the laser. So the pill takes like a half hour to work. So we're going to start the process by the time we do all the marking. And
So I'm going into a yoga retreat in 2 weeks from today. I'll be good by then to like stretch and hike and all that. Okay.
you may still feel a little bit here and there, like when you stretch you may be sore or a little tight. Nothing bad is going to happen. You can do everything. If you do too much of something, you may still be sore.
And this is the Halcyon, the happy pill. So I'm going to put this into your hand, put this right underneath your tongue. It will melt in a couple minutes. Full disclosure, it's a little bit bitter when it melts. As soon as it melts, I can give you more water, okay? Super ready, okay? Amazing job.
This is going to look so nice. I already see it. Okay.
Now I can just lay down.
Think happy thoughts.
Love it.
A lot of it is scar tissue in there. Put a little bit of stem cells in there. Are you comfortable laying on your stomach?
I can.
Okay. Because that's probably going to be the
Yeah.
best way to do the
That's
back. Yeah. All right. Good night.
Good night.
I may actually have her do it from side to side.
Gonna feel a little cold, okay? This is gonna help clean and sterilize the area for the doctor.
I'm going to numb this area for you. Going to feel a little pinch here. A little pinch. This is all the water going in. There's nothing sharp, okay? We don't have any needles in there anymore. Just the water going in, just the numbing, just the tumescent solution. This is all the scar tissue I'm stretching out. You look better after I'm done. You feel the collagen fibers stretching. It's just tight. So very, very tight here. There's nothing sharp, just the water going in again. All the hard part is done. Now, we're just gonna wait for the numbing and then I'll come back and we'll get the cells.
So it doesn't hurt when you take it out?
No.
Under my eyes, none of that hurts?
The under eyes, you may feel some pressure for 3 seconds, but nothing like that. That one is a lot of scar tissue. It's super strong. Okay, we're gonna start taking out some fat.
It's like gold.
Gold! I'm very excited.
Not
That's all the fat.
That's fat. I like it.
You're beautiful fat.
You got me really excited.
I mean, it should be full of avocado, peanut butter.
Good stuff.
That's the only fat I eat. Walnuts.
You'll put it to good use.
I take it from bigger hips, thighs, their lower back has more fat, so contour the whole area. I sort of sculpt, I frame the butt. But the good thing is you can take it from where you didn't want it and put it to where you do want it. And you don't have all the scars and all the downtime.
Just like sticking something back and forth and sucking out the fat.
It's a cannula. The cannula is just not sharp, just a long tube that goes in and helps us take out the fat. It just feels weird because I'm right under your skin.
Good stuff. 500 times more stem cells than bone marrow.
You remember? Well, you do need some fat, especially women. Their hormones are out of whack because
Their
there's no,
bones are terrible.
yeah, because there's no way of converting those hormones. Fixing the dent that you had here. It bothered me that was there. It's like you have this great body, this physique, and then they're like, what is that? That doesn't belong there. Wow, look at that. You got really good stem cells. All of that is stem cell right there. So that's a lot. And I haven't even done anything to get it concentrated. This is just me taking it out of you. Because you're healthy. You're young. You eat well. You exercise.
So if you're doing like a full facelift, how much do you have to have?
If somebody with a full face, anywhere between 30 to 80 cc's. Most people may need a little bit less if they're younger, if they're a little bit older and more. But I usually do the face with the hands, and the hands take about 20 cc's. The eyes will make a big difference for you.
Just iodine.
Ready? Numb you. Your whole mouth is gonna go numb like a dentist.
No bruising.
No bruising, that's all we want. And you feel 10 times more swollen because of the numbing.
I feel like somebody punched me in the lip too.
The halfway mark. You can see the difference. I put 4 here, I put 3 here, so you can see the difference between 4 and 4.
Still can't believe you did Morpheus with no numbing to your face, your neck, your chest, and your arms. Yes, my husband was not a great experience for him.
For him. Perfecto. You see the difference now? At 1 cc.
This is the prepping solution, and I'm also cleaning off the iodine at the same time.
So hold your breath for a second. I'm gonna go right under your nose. Put small scary strips over the needle marks where Dr. Newman went. Those leave on for tonight. Tomorrow morning we'll take them off. You don't have to worry about them.
We do not want you to take a shower today until after you see us tomorrow.
But we just have to let it heal and let the swelling go down.
3 months after today, the cells will be completely incorporated into the tissues. So that change is basically permanent. The reason we say 5 to 10 years is because you age. So every 5 to 10 years, if you look at your face, you'll notice some aging. So that's why we say 5 to 10 years. But the change is permanent. Once it cracks, it's your own. It ages with you, it changes with you.
So I might have to do this again in 5 or 10 years.
For you, probably not. Maybe like 20, 30 years.
We have a little to-go bag for you. We'll go over everything.
Sprinkle lotion on my body.
You can stay away from the areas where you can get the harvesting, but everywhere else you can.
Your skin is going to get hydrated, super hydrated with the plant stem cell factors here. You're going to have baby skin.
I listen. No lotion.
Yeah, because I don't know where I'm going to take it and all that. Now you can...
Well, I'm excited to get the serum.
Good.
That was easy.
Perfect, I like perfect.
I mean, I think it'll work out.
You could, hypothetically, but you'd just be very sore tomorrow. We're going to give you the serum to reduce inflammation, so put that on.
It's going to help reduce inflammation throughout your whole body. You put your hand in there and it's going to tighten up at your wrist. We have receptors in the palms of our hand and the soles of our feet, but it's easier for us to have the patient put our hand. It tightens at your wrist to open up the blood vessels so that heat can flow throughout your body. So it's meant to help get rid of inflammation by normalizing your body core temperature.
I feel fine. My eyes feel swollen. It's more that I'm just numb. It doesn't hurt, and everyone says it looks good, so I'm excited to see it. But it's hard to smile because my mouth's numb.
You look fantastic. You got a little bit of swelling here. Everything looks really, really good. Just ice it for the next few days. The swelling will go down and you'll look really good in about 2 weeks.
Wonderful.
You did amazing.
I feel a little sore, but it's not awful. Kind of like when you chew, you have a little bit of soreness through here, but it's like a 2 out of 10 maybe. The area where he took the fat is a little sore too. Again, it's nothing terrible, like probably 2 or 3 out of 10. I went to dinner last night, had dinner, I slept fine. So people look at you and you don't realize why they're looking at you funny more than anything. Cause I mean, I feel fine. So I'm excited. Other than my bruise, it looks great.
So the next question I have for you is, can I go get in a really nice red light bed tomorrow?
Yes, the only thing we don't want you to do is go in the pool or a jacuzzi.
Okay, so no cold plunge either?
I wouldn't for now because we want to make sure everything closes. The red light bed will be awesome. We're actually going to put you under our red light therapy also.
I didn't realize he went in down here so low.
Yeah, so he uses the cannula. So he goes in a little lower. You're not going to be able to tell. These little tiny holes are going to be closed. Right now you can kind of see there's a little dot there, but it's already closed and they heal very nicely. Because we're going to do the 2.5 pH level water. These gauze are soaked in the water. We use this to help decrease inflammation, so it's anti-inflammatory. It's also antibacterial, antifungal. If you're okay with it, I'm going to put one just right over your eye. It's a little bit of Dr. Newman's product, just right on this spot. It's a little red. Perfect. Without the bruising and the swelling and how good you're going to look. Have a safe flight and
Thank you, Ash.
have a good time tonight.